we will go directly to the next presentations in the opening, or the last presentation in the opening session, which is by Irini Kessissoglou. She's a policy officer at the European Commission's Directorate General for Health and Food Safety. And her work focuses on data usage for public health research and policy, and she's involved in the European Health Data Space Initiative.
Thank you very much. First of all, thank you very much for the invitation, and thank you very much for presenting me. Thank you. So today, I will present you the European Health Data Space, which is actually a big, I wouldn't call it initiative. It's also supported by a regulation, the European Health Data Space regulation that was adopted recently. And you will learn a bit more about it, and more specifically about the part on the reuse of health data. So the European Health Data Space, the Health Data Space, is the first of 9 European data spaces that will be created in the future. There will be a data space for agriculture, mobility, Green Deal, etc. And the importance here is that all of these European data spaces will have to be interoperable. So we start with the health data space, and the building blocks that we're developing, we hope that they will be also integrated as part of the other European data spaces. The European Health Data Space, in a nutshell, what is it about? It's first of all a data space supported by a regulation, a European regulation, and this regulation is divided in 3 parts: the primary use, the secondary use, and the requirements for electronic health record systems. So just briefly to mention the primary use part, which is not so relevant for Hedimed, but still I think it's important to know it, because otherwise you don't know what the European Health Data Space is. So the primary use is about the use of data for the delivery of healthcare. So this part of the regulation is ensuring patients' rights to access their health data in an electronic format wherever they are in Europe. It's also ensuring seamless exchange of health data for continuity of care, which means that if I'm a Greek citizen traveling from Greece to Belgium, I can first of all get my prescriptions, for example, in Belgium. I can also, if anything happens and I go to the hospital, then they can get my patient summary translated in French or Dutch directly, and take care of me right away. They would not need to repeat the tests. So this is the main and biggest, let's say, benefit of the primary use of part of the European Health Data Space. Then we have the secondary use, which is about the reuse of health data for a different purpose than the one they were initially collected for. So it's about reusing many different categories of health data for research, policymaking, innovation, etc., in a secure and streamlined way. And finally, there's the part on the requirements for electronic health record systems, and this goes more with the primary use, because now we're creating the European Electronic Health Record Exchange format, which means that 6 categories of data will have to be structured at source in a common way, so that this translation that I was mentioning earlier can happen, and this seamless exchange of data can happen. And this creates a single market for electronic health record systems, supporting both primary and secondary use. But today we will focus mainly on the secondary use part of the European Health Data Space, and I will let you know a bit more. So, what are the benefits for whom? Who will have to make which data available, and for what purposes? The European Health Data Space regulation is putting common European rules on who has to make which data available, for which purposes, and under which conditions. From 2029 onwards, so the date of application of the European Health Data Space regulation, there will be no more the need for patient consent when you want to access data for secondary use. However, citizens will always have the possibility to opt out from the reuse of their health data. The European Health Data Space is building a common infrastructure, a cross-border infrastructure called the Health Data at EU, and I will tell you a bit more about it in the next slides. So I mentioned first of all that there is no more need for consent anymore. However, the European Health Data Space is putting safeguards in order to ensure the data privacy and safety of the data, of health data, because it's sensitive data. So first of all, a big safeguard is the secure processing environment. So the Health Data at EU infrastructure that we're building is a federated infrastructure. The data does not move away from the member state. It stays at the member state. We're not developing a common data lake or a central data repository. No, not at all. It's basically data stays at the member state, and the user, the researcher, for example, would be able to access this data and analyze it in an anonymized or a pseudonymized way inside secure processing environments that will be provided at member state level. Then, as I mentioned before, natural persons have the right to opt out from the reuse of their health data so that they will be able at member state level to go in the national bodies and say, I would like to opt out from the reuse of my data. Another safeguard is the fact that data minimization and purpose limitation is the fact that researchers cannot access unlimited amount of data. They would have to explain the purpose for which they want to access the data, and they would access only the specific data that the health data access body would find that they need to use in order to perform their research study. And if they can access it in a fully anonymized way, then this would be the default. However, if they show that they need to access it in a pseudonymized way, then they can access it in a pseudonymized way. Other safeguards are the allowed and prohibited purposes that I will go on in the next slide, where you will see that you cannot access data for any purpose. There are some prohibited purposes that you will not receive access to. So when we talk about health data, as you will see also in the regulation article 51, and on this slide, we're talking about a very broad categories of data. So it goes from electronic health data from electronic health records, hospital data, administrative data, data from medical devices, wellness applications, data from population-based health data registries. You will get also access to data from medical registries, mortality registries, biobanks, data from human genetic, epigenomic, and genomic data, which could be very useful also for your research studies. And most importantly for this Hedimed, I think it's also data on factors impacting health, so including socioeconomic, environmental, and behavioral determinants of health, aggregated data on healthcare needs, resources allocated to healthcare, pathogen data impacting on human health, but also data from clinical trials, clinical studies, data from research cohorts, questionnaires, and surveys, which means that also the data that you have been collecting, so research data is also included into the data categories that are covered by the European Health Data Space. And who are these data holders? So who is in scope? Who would need to make this data available from 2029 onwards? Any natural person or legal person, public authority, agency, or other body in the health or care sector, including reimbursement services when necessary. Any natural person developing products or services intended for the healthcare or care sectors. Any natural or legal person conducting research related to the healthcare or care sectors, any natural person acting as a mortality registry, as well as any institution, body, office, or agency of the Union. That means that also the European Union, the Commission, agencies and offices that have data, they will also have to make them available for secondary use. All of these, and they have to have the right or obligation to process or the ability to make this data available, and of course be established in the EU. Now, to this definition of who is a data holder, there are some exemptions. For example, individual researchers or natural persons, individual general practitioners, microenterprises are exempted. But at national level, a member state can create a national law and extend the obligation of data holders also to the exempted entities. And then beforehand, I mentioned that there's some purposes for which you can or cannot access data. So these are the prohibited and allowed purposes. With the European Health Data Space, as an applicant, you cannot request and you cannot access data to make decisions detrimental to individuals or groups based on electronic health data qualifying as decisions if they have legal, social, or economic impacts. You cannot make employment-related decisions or offering less favorable terms in goods or services. You cannot conduct advertising or marketing activities. You cannot develop products or services that could harm individuals, and you cannot, of course, engage in activities that conflict with ethical standards set by national law. So for these purposes, you cannot access health data through the EHDS. But you can, however, request access to health data for public interest in the area of public and occupational health, for policymaking and regulatory activities, statistics, education or teaching activities, scientific research, and for improving delivery of care, treatment, optimization, and providing healthcare. And here is this cross-border infrastructure that we're building, the Health Data at EU. This is the core and the architecture of the European Health Data Space for secondary use. And this is basically what will enable this seamless and facilitate this reuse of health data across Europe. So the way this works is that you have in the middle the EU Central Platform. This is just a platform that is hosted by the Commission, and it only has a common metadata catalog. So this is a catalog where anyone can find what kind of data is available across Europe, but they will not see the data. You only see metadata records, so you see a description of the data sets. And then any researcher or any applicant can basically fill in a common data access application form to request access to the datasets that they have found in the metadata catalog. And then this application, so it's a one application that will be distributed to as many national health data access bodies as you have requested. So as you see, this EU Central Platform is linked at national level with a health data access body. And this health data access body is a key entity at national level because they're the ones taking decision on a permit to access data. So the health data access body can be one or multiple at each member state, and they need to have the national metadata catalog, again, a description of the data that they have at member state level that will be using the same standard, so the same metadata standard across Europe. That's why they're interoperable and they can be then all feeding into the EU common metadata catalog. They will receive the data access application forms from the user, and they will have to assess it and then provide a permit to the user to access the data in a secure processing environment. So the health data access body is also the place that will provide a secure processing environment for the user to analyze the data. So as you see, at national level, the data is not moving anywhere. The data holders are, for example, hospitals, registries, researchers that would have to put the data in a secure processing environment, and the data user goes there to use it. Of course, in this graph, you also see other participants. You have the authorized participants, which are research infrastructures or data infrastructures, or they will be also connected to the EU Central Platform, but they have a different governance system than the EHDS. You will have third countries in the future, and you have the Union Health Data Access Service, which is the health data access body for the European Commission data, EMA, ECDC, etc. So here is a user journey, an example of a user journey of a researcher on exposomic determinants for different immune-mediated diseases. So I tried to take an example that would speak to you a bit. So if I'm a researcher on exposomic determinants, I would first of all go to the common EU metadata catalog, and I will type basically my keywords on the catalog to find what kind of health data is available across Europe that would support my research. So let's say that I went to the catalog and I found data in Spain, and I would like to actually access data from different, not so much from different member states, but I would like to access data from different data sources. So I would like to access data from hospital data, electronic health records, but also genomic data sets and environmental determinants of health. So I will find these three data sets in Spain, and I will fill in a common data access application form. So I fill in the common data access application form, and where I describe the purpose of my research, what variables I will need, and what exactly am I going to do. Then the health data access body in Spain will receive this data access application form, will contact the health data holders that have these three different data sets, and will request their data to be put in a secure processing environment. And this is when the data preparation happens. So then the health data access body will have to link these data sets at individual level. This is key. It's a benefit actually from the European health data space, because it will enable you to have access to different data sources linked at individual level, and then you can go and do your research on exposomic determinants. They will prepare the data after they have issued the permit, of course, and ensuring data quality and privacy. And then they will provide this data prepared, linked, and pseudonymized inside a secure processing environment. And this is where the user will go and analyze the data, process the data, and they can only extract fully aggregated anonymized results. The user will not extract outside of the secure processing environment identifiable data. And then, of course, they will have to publish the data They will have to publish the results, the research, etc. When will all of this happen? What are the timelines and implementation of the European Health Data Space? You might know, but the regulation has been now signed and published in the official journal of the EU on the 5th of March. Then we had a high-level conference to celebrate the adoption of the European Health Data Space, co-organized by the Polish presidency on the 18th of March in Brussels. And it finally entered into force on the 26th of March. Now, entry into force means that it's the beginning of the transition period towards the entry into application. And the entry into application of the European Health Data Space is 2029 for most provisions. So here's the overall timeline. You have, as I mentioned before, entry into force 2025. In 2027, we will have the first deadline for our implementing acts, but this is something for the Commission. We will have to develop the implementing acts and adopt them by 2027. And then most provisions that I mentioned before in primary use, the exchange of electronic patient summaries, prescriptions, and dispensations between member states will start in 2029. The electronic health record systems that will have to be compliant in the exchange format will also start in 2029. And in secondary use, basically the Health Data at EU infrastructure that I just presented will have to be fully operational by 2029. And by 2029, you will be able to do all of the things that I mentioned in the user journey. So find data, request access to the data, and analyze the data in a secure processing environment. Now, for selected categories of data, such as genomics and wellness application data, that will come in 2031. And in order to get there, we have several projects in the Commission that are running to make sure that we are ready by 2029. So first, we have the TEDAS2 joint action. It's a joint action that is developing. So joint action means a group of member states. All member states are represented, and they're developing the guidelines and technical specifications on most of the provisions that will go into implementing acts. Then we have the project called Shaped that is working on using the EHDS in order to develop, validate, and deploy AI, artificial intelligence models for medical devices. And then we have several projects that work on the more building up of the infrastructure, such as the Central Services project, building the EU Central Platform. We have direct grants to member states to establish their national health data access bodies. We have a project on capacity building that develops trainings. We have the Quantum, the data quality and utility label that will develop specifications on a label that will basically be put on the metadata record and determine whether a data set is of high quality or not. So that will help basically the user to know whether they should use it or ask for access to it or not. And then we will have the compliance checks and stakeholder support center. So that's all from my side. Thank you very much. And yeah, I'm open to questions.